Peripheral IV access. To perform this procedure, you will need the following equipment: a tourniquet, IV setup, dressing, and gloves. Wear gloves and any other appropriate PPE as needed based on local protocols and the patient's situation. Then initiate any appropriate BLS and ALS procedures. Decide if vascular access is needed. Explain the procedure to the patient and why it is necessary. To start an IV, begin by preparing your equipment. Make sure the fluid is clear and has not expired. Clamp the tubing and attach the infusion set to the bag. Squeeze the reservoir until it is half full. Then open the clamp and flush the air from the tubing. Close the clamp when all the air has been expelled from the tubing. Select the desired size IV catheter. Prepare antiseptic wipes, dressing, tape, and tourniquet. Select the appropriate peripheral venous site. Sites for peripheral IV access include the arm, the long saphenous vein of the leg in appropriate patients, or the external jugular vein, if allowed by protocol. Apply a tourniquet 4 to 6 inches above the site. Make sure it is tight enough to occlude venous but not arterial blood flow. If a site is difficult to see or feel, try the following. Lightly tap the proposed site, hang it at a level below the heart, or apply a warm compress to enhance the blood flow to the area. Cleanse the site beginning in the center and working outward in a circular motion. Use the antiseptic indicated by local protocol. Retract the patient's skin firmly distal to the site to stabilize the vein. Enter the vein with the needle bevel up in adults, down in young children and infants, and advance until a flash of blood is observed. Advance the catheter into the vein to within a millimeter of the hub. Release the tourniquet. Remove the needle while stabilizing the catheter and place in an appropriate sharps container. Apply pressure on the proximal end of the catheter to stop blood flow. Then firmly attach the IV tubing. Open the tubing clamp to adjust the flow of the IV and observe the site to ensure there is no swelling. Administer the IV fluids at the prescribed flow rate. Secure the catheter and IV tubing and cover the site with a dressing and/or an ointment approved by your medical director. Continue to monitor the patient and the site. Complete the appropriate documentation after the call.
Okay, ma'am, we're going to have to start an IV on you, and basically going to put a needle in the back of your hand. We do that so that if you have to give you any medications later on, we can just do it through your IV.
Okay.
man, we're going to put this tourniquet on you here. It's going to feel a little pinch. Okay. Okay, man, you're going to feel a little stick here. Try not to move. I'm going to count to 3. 1, 2, 3. Okay, it's all over with. You doing okay?
Fine.
Okay, let's see if you did okay. Think that runs. I don't see any infiltration anywhere.